Welcome to the NIOSH Total Worker Health webinar series. Today we focus on where exposure meets sensor technologies, a look at the opportunities and complexities. I'd like to welcome our moderator and presenter, Dr. Paul Schulte. Dr. Schulte is the Director of the Division of Science Integration and co-manager of the Nanotechnology Research Center with the National Institute for Occupational Safety and Health, with the Centers for Disease Control and Prevention. Dr. Schulte has 40 years of experience in conducting research and developing guidance on occupational cancer, nanomaterials, risk communication, workplace well-being, and genetics. He also has examined the convergence of occupational safety and health and green chemistry and sustainability. He is the co-editor of the textbook entitled Molecular Epidemiology, Principles and Practices. He has served as guest editor of the Journal of Occupational Medicine and the American Journal of Industrial Medicine and was on the initial editorial board of Cancer Epidemiology, Biomarkers, and Prevention. Dr. Emanuele Cauda is our featured speaker today. Dr. Cauda is a senior research engineer at the Pittsburgh Mining Research Division in NIOSH in Pittsburgh, Pennsylvania. Dr. Cauda is also the co-director of the NIOSH Center for Direct Reading and Sensor Technologies, coordinating several activities and leading the initiative Right Sensors Used Right. Dr. Cauda completed his PhD in chemical engineering at the Politecnico of Torino, Italy in 2005, and he joined NIOSH in 2007. Dr. Cauda's research focuses on monitoring characterization and control of aerosols present in occupational environments, and specifically dust, silica, and diesel particulate matter. Our next featured presenter will be Jennifer Sahmel, a managing principal scientist with Insight Exposure and Risk Sciences in Boulder, Colorado, where she works on a wide range of projects related to human health exposure and risk assessment. She is a certified industrial hygienist and a certified safety professional with over 23 years of experience in exposure assessment science and workplace health and safety. Her areas of expertise include exposure assessment and reconstruction, qualitative and quantitative dermal exposure assessment methods, Bayesian decision analysis, and EPA exposure assessment tools. Jennifer earned her MPH degree in Environmental Health and Industrial Hygiene from the University of California at Berkeley in 1996 and is currently working on her PhD in Environmental Health Science at the University of Minnesota. She is a research fellow with the University of Minnesota's Exposure Science and Sustainability Institute. A few housekeeping items of note before we begin today. Your audio will be coming from your computer speakers or earphones. Please ensure that your volume is turned up to a comfortable level. For further technical support, please contact Adobe Connect for additional support. Captions are available for this meeting for anyone who would like to follow along. They can be viewed in real time in the Adobe Connect screen or opened in a separate web browser via the link provided in the Notes for Attendees box. Much of the information on the previous slide is included in the Notes for Attendees box that you may reference throughout the webinar. If you're wishing to supplement the viewing from today's webinar, you may email twh@cdc.gov to request the unedited transcript from today's webinar. During the webinar, you can submit comments, questions, problems, or concerns to the Q&A box at the bottom of your screen. All presenters and meeting hosts will be able to see what you submit into the box and can respond accordingly. You may submit questions throughout the presentation. However, content-related questions will be addressed only at the end of the webinar during the Q&A session. If you would like to download any of the slides shared during our presentation today, you may do so just below the Q&A box or by emailing twh@cdc.gov following the presentation. Continuing education credits are available for this presentation through the CDC's Training and Continuing Education's online system. Detailed instructions on accessing the Training and Continuing Education office site are available for download. Please note that the orange activity number is only valid for those watching the live webinar. You will need the course access code to receive credit. The blue activity number is to be used only by those who viewed the archived webinar. This webinar will be recorded and posted in the near future for those who couldn't join us today. It is now my pleasure to turn the presentation over to Dr. Paul Schulte.
Thank you very much. It's a pleasure to be here. We have a very interesting program for you today. We're going to look at the interface of sensors, total worker exposure, and total worker health. And my job is to try to sort out some of the terms to describe these kinds of holistic approaches to work and safety. These are the kinds of terms that we will be seeing and hearing about today. So clearly, total worker health, many of you might be familiar with that, and I'll talk about it briefly. Total work or total worker exposure is a term that relates to total worker health, particularly focusing on the exposure aspect. And then there are two other terms. One I have here, cumulative risk assessment, and I'll talk about that, and that feeds into total worker exposure and total worker health. And another term you'll hear, I don't have it on this slide, exposomics, and I'll talk a bit about them. And so the question arises, why do we need these kinds of holistic approaches? And the answer is, it shouldn't be a shock to most of you, that the nature of work, the workforce, and the workplace is rapidly changing. And it's getting a lot more complex in many ways. Many of the easy cause and effect relationships have already been identified. That doesn't mean that there aren't some that still need to be assessed. The relationship between an exposure and a toxic effect, for example, for many substances is still a question. But we have an experience with how to do that. We have an awareness of that. And so the need now is for thinking about what the reality is. And the reality is that people are exposed to multiple exposures. People have multiple exposures. The health of the workforce, which is intimately tied to its effectiveness and productivity, relates to a variety of factors. And we, in the occupational safety and health field, have only looked at a limited number of these. And the gist of the holistic approach is to look at more things. And so our historic approach of taking a measurement of a single substance to see whether it's above or below a limit, while still useful, doesn't meet the full needs of employers or other clients. They need to know what are the factors that keep their workforce happy, healthy, and productive. And indeed, that's where our point of departure. And if we can identify those kind of factors and do that kind of analysis, we have then the potential for making an improved impact on worker health and on prevention. So that's the background for this. Here it is pictorially, if you will. So we can talk about what kinds of exposures a person has, the totality of worker exposures. And as I said, one of the terms that relates to that is exposomics. And when we know that, we can feed exposure and potency information into a risk assessment model, and that would be cumulative risk assessment. And I'll explain these all in more depth. They will then help us make risk management decisions, and the risk management decisions will be a major part in helping to achieve total worker health. Now, we know that work is a primary determinant of health. Often people forget that, and indeed that's a critical challenge for us to constantly be reminding people of the importance of work. But treating work separately from the rest of life, home and other times of life, is problematic because many of the factors that are in work or in home the rest of life, they may interact. they may be additive, they may be synergistic, and we need to take a more holistic view of these, and that's indeed what that picture shows. And so total worker health takes that realization and it puts it into policies, programs, and practices that integrate the protection of work-related safety and health hazards with the promotion of injury and illness prevention efforts. And all of that is to advance well-being, worker well-being. And well-being is a term that has always been used in safety and health literature, but often it's and well-being as a conjunctive. We're in an era now where countries and disciplines are really examining what is meant by well-being, trying to operationalize it, trying to use it as dependent or independent variables in research and as targets in policy. And so total worker health is the foundational effort to advance worker well-being. Here it is formulaically. In order to total worker health is keeping workers safe, plus establishing policies and practices and programs that grow health to create worker well-being. So indeed, it's both protection and the promotion of health that are critical. Not one is sufficient for total worker health. Here are some examples. One is the provision of mandatory respiratory protection in workplaces where there are particulate or vapor hazards. This is appropriate, but it misses the boat if we don't look at the whole, the totality of things that affect workers, and one of the biggest things could be cigarette smoking. And so total worker health approach also has a comprehensive way to, or aims to comprehensively address tobacco cessation as well as respirator and respiratory protection. So that's an example there. Another example is in terms of noise and hearing conservation. And we know that noise is a significant hazard, and so there is a whole panoply of measures for surrounding materials that make noise to reduce the noise, and hence reduce the risk to hearing loss. But hearing loss is a cumulative outcome. And so any noise, whether it's in work or whether it's in leisure or at home, can contribute to hearing loss. So a total worker approach, a total worker health approach, addresses both the workplace and provides guidance for strategies to limit other risks to hearing, such as loud music or sound. Just the slide. And back here, the third example then is with the issue of musculoskeletal hazards, and programs such as in the healthcare sector that address ergonomic issues and provide ergonomic guidance, or in this case patient lift assists, will help reduce musculoskeletal hazards. At the same time, and we're seeing this increasingly as we have an aging population, arthritis is a critical chronic disease that burdens workers and then can be addressed also by ergonomic changes and various self-management strategies. And so thinking about them together is an example of a total worker health approach. Now, you're all familiar with the hierarchy of controls, and total worker health really builds off this hierarchy, starting with the most effective, the elimination, proceeding through substitution, redesign, education, and encouragement. And a critical thing with total worker health is that it does not devolve to just the worker. It also, and primarily, is a focus for the employers, because it's the employers who have the resources to make the changes and to protect workers against the hazards. Workers will have to participate in some of these activities, and we'll have to have the same kinds of information, but the primary responsibility is with the employers. And so we can go back and look at this holistic approach and take apart some of the pieces that lead to total worker health. And we can start with the whole concept of exposures. And as I said, there can be exposures in work and there can be exposures at home. And what we're trying to do is come up with the totality of worker exposure. Well, that's not an easy task, as you can well imagine. And indeed, did I miss one? And so one of the terms that looks at the totality of exposures is called the exposome. And the exposome was developed as a term in 2005 by Christopher Wild, who's the director of the International Agency for Research on Cancer. And the concept there is, his concept was that societies have spent a lot of money on the genome, the totality of genetic material that we have, the genes and chromosomes and the stretches of DNA, and focused on them almost at the expense of the environment. And indeed, in many cases, the environment is more causal than the genome. And indeed, there's much interaction is the reality. But so Christopher Wild wanted to increase the consciousness around the environment and came up with the term exposome. And that's the totality of exposures received by a person during life. And a more operational definition was put forth by Steve Rappaport when he talked about all the biologically active chemicals inside a person during life. So something that can potentially be accessed by blood or urine or buccal cells might be a way to think about how we start to get our arms around the totality of exposures. Now, as I said, this is a huge thing. We're talking about not only a cross-section, what a person is being exposed to at any given time, but with the exposome and with cumulative risk assessment, which I'll talk about, we're looking at along their whole lifespan. And so this is a huge set of data, if we could ever get it, and how you put it together, how you make sense out of it, are all the current questions of the field. And so to start on that, here's one of the early simplistic approaches. This is what's known as the exposome correlation globe. And essentially, it just shows the different kinds of exposures that can occur and the correlations between them, and the thickness of the line indicates the greater the correlation. And so, as I said, we're really getting our hands around, we as the field are really getting our hands around how we're going to make sense out of huge amounts of data on all different kinds of exposures. And so when we talk about total worker exposure, we can make a lot of progress, but we have a hard road to hoe. And then cumulative risk assessment is a similar kind of thing. It's the combination of risks from exposure to chemical, but also non-chemical stressors, psychosocial stressors, for example, and including the possibility that these hazards may interact in various ways to modify toxic effects and adverse outcomes. And so cumulative risk assessment follows on from exposomics and is a way of putting together exposure, severity, and the probability of effect. And indeed, it too is a new and growing field. And so, as we move toward our featured speakers, I just want to identify and review for you essentially what most of you are familiar with, how we currently assess exposure of workers. And we do that in a variety of ways. We use questionnaires and job exposure matrices, task observation. We can do surface and skin monitoring to get a snapshot. We can model a lot of different kinds of information. We can do biologic monitoring, looking at accessible bodily fluids. And then, and particularly what we'll be looking at a lot today, we can do air monitoring. And we know that we can do air monitoring on an area basis or in the personal breathing zone. And one of the things about these kinds of monitoring approaches is that we don't generally get immediate results. Now, you can take some direct reading instruments out in the field when you're doing research, but essentially in day-to-day life of workers, there are no immediate results. Whereas we're going to hear today about direct reading sensors that generally give immediate results, and hence, in a sense, immediate empowerment maybe to do something about those results or to at least think about them. And so we're going to hear a lot about that dynamic of how we can do direct reading and the implications of having that kind of information. And that, just to backtrack, that then feeds into our better thinking about exposure of workers and better thinking about then different ways to put that information together to start to get a better handle on the totality of exposures and ultimately total worker health. I'm sorry, I went too far. And so just to sum up then in terms of exposure, we have a variety of components that help us lead to an integrated exposure assessment. So we have the traditional hazard and exposure measurements in an occupational setting, but we also have what we learned from the environmental setting. We have biologic markers, biologic indicators of exposure, effect, or susceptibility. And then we have large data sets of already gathered information and ways of making sense out of that information using GIS and other sorting methods. And then we have what we're going to be hearing today, direct reading and sensor technologies. And when we put all these together, we can get an integrated exposure assessment, and it can lead to the protection of worker health. So that's the overview that I wanted to give you, and I hope that it sets the stage then for the presentations of Emanuele and Jennifer, which I think really will take this to the next level. So without further ado, I will then turn the podium over to Emanuele Cauda, and he will talk about wearable sensors. Emanuele.
Thank you very much, Paul, for the first introductory content for this webinar. So my contribution is going to be a really technical or semi-technical contribution about wearable sensors for monitoring 4.0, where 4.0 stands for the fourth industrial revolution or industry 4.0. We are living in an environment, so we are living our life where there are sensors everywhere. We have smart cities, we have smart houses, we have smart industries, and we are going to have smart cars quite soon. From an health and safety perspective, personal sensors have been common practice in the workplace for a long time. We can start from canneries many years ago. We have noise level personal monitors. We have monitors that can record video of what a worker is doing through the day. We have gas and vapor monitors, or dust or particulate monitors hazard monitors for hazard conditions in terms of gas and vapor again, to the point of nanoparticles personal monitors. When these personal monitors, we are considering more in terms of wearables. Everybody is thinking in something, a monitor that is at our wrist, like a counter for steps, or safety glasses, or glasses with augmented reality, or smart glasses, to the point that the old vest or the old clothing and that we're going to have are going to be full of sensors, or our body is going to be composed of different sensors. So smart clothing, for example, is a big topic at the moment from a technology perspective, to the point that wearable sensor can be actually inside the body, like implantable. So they are inside and they are monitoring different information that they are needed. All this means integration of monitors that are generating data, and they need to interact with each other. So if we want to define exactly what could be considered wearables, different from personal monitors, one possible distinction can be the wearable sensors are integrated into wearable objects, something that we are already wearing, or the actually wearable sensors are directly inside or on the body for monitoring purposes. When we talk about sensors, I think that it's important already to make a distinction between direct reading methodologies and real-time monitors. A direct reading methodology can provide information when needed, like a scale at your home, or a thermometer to check for fever, or a glucose meter for diabetes. So we get that information when we want it, differently from traditional methods like 50 years ago, only 20 years ago. A question, and I'm going to start asking questions through my slides, is enough to have direct reading, or we will need to have real-time monitoring for a certain application? And this is a question we need to ask when we adopt a new technology. And do we have confidence in the data that are generated by that methodologies? Or do we need to have confidence? Are we needed for our objective? And can we afford to pay for a certain level of confidence? Different from direct reading methodologies, but just one level up, can be real-time monitors. If you think about the gas level, the gas meter in your car, that's a real-time monitor. It's giving you continuously information about the level of gas in your tank, or something like a Fitbit to check for the level of workout you're doing, and then you can check the data that have been recorded continuously. And once again, also in this case, the confidence in the data and how much confidence we need to have, or we have, is a question that we need to answer. By adopting these technologies, so real-time monitors or direct reading methodologies, there are indeed several benefits, but there are also new responsibilities for sure. And so this idea of the benefit and responsibility is the topic of the NIOSH Center for Direct Reading and Sensor Technologies, and I'm one of the two directors for this center. And basically, we have an idea to coordinate the research about the adoption of new technologies in occupational health and safety with different goals, from development of guidance documents, training documents, and trying to be in the mix of the discussion about these methodologies. We also have an initiative that is called Right Sensor, User Right, which I think could be interesting, especially from a perspective of wearable sensors. The initiative is composed of two components: the idea of right sensors, so the selection of appropriate sensor methodologies to meet mission objectives, and then the sensor needs to be used in the right way, so the appropriate usage of a methodology to obtain the data that we wanted. We really like the idea to consider of a life cycle for a new technology like sensors, or the use of data from sensors. And so sensors are not really only a gadget, but there was a mission evaluation, there was the construction of a prototype, there was some testing in the field, there is a need of training, there is a need of maintenance and calibration in the field. In the frame of health and safety, there are different people or group of people that are involved, and I have a list here that is definitely not comprehensive. But the one that is missing when we talk about direct reading methodologies and real-time sensors are really the analytical labs. So somebody that is the beacon of the standard quality of the data. And that's true if you think about it, even for wearable sensor that we're already using in our life, there's actually nobody that is ensuring that the quality of the data is such based on a sort of standard. There are standards for the construction, not for the performance of the data. And so this responsibility is generally for the labs needs to be shared by everybody by adopting a right sensor user right approach. So the first step about the use of a new technology like a wearable sensor, but actually real-time monitors and direct read methodologies, is to define the objective. What is the purpose of using this sensor, like personal sensor in health and safety, for example? I listed a few of them just to give you some ideas. One possibility can be to alert a person, means the worker, that a condition is met, so hazard. Or to do mapping. We want to identify the sources for a high concentration of a certain condition. Or we want to do a survey for task or temporal availability, whether during the day or through the months and years. Or we want to evaluate administrative control. So are we controlling that exposure? Are we effective in controlling the exposure by adopting some certain administrative controls or engineering controls, ventilation, methodologies to reduce the concentration of a certain condition. Or we want to do a comprehensive risk exposure assessment, or we want to do compliance monitoring. So we want to use the personal sensor to monitor the level of compliance to a certain regulation. And finally, there can be training, continued education that can be facilitated by the use of personal sensor. Well, when we think about these possible objectives, and then we think about total worker health or total worker exposure, as Paul has presented, there can be very specific objectives of using wearable sensor in that frame, because, for example, it's possible that the timetable and the time scale can be different. We might need to monitor for a long time, for months in a row, or it's possible that the objective is slightly different based on the need that we have for those data. And so when the objectives are clear, we can consider better the components of a wearable sensor or a personal monitor. Generally, there's always a sensing element. Then we have a microprocessor that is crunching the raw data and the signal, and there might be a need of power to operate this activity. Data are generally crucial. Data management and everything related to Internet of Things is really key for wearable sensors. And finally, there can be a display or a graphic user interface to interact with the person that is wearing that personal monitor or wearable. So are all these components equally important? And the answer is it really depends on the objective. There can be a wearable sensor where there's absolutely no graphic user interface. We are not giving any feedback to the person wearing the sensor, but the data are just transferred to the cloud. Or there can be some wearables where there's no transferring of data, but the graphic user interface, so the feedback to the user, is the most important component. So the objective and the goal are critical. When we think about the sensor, we really need to think about a process from the generation of a signal to the creation of data through processing, and from the data into valuable information. And that's key all the time. Next step after the objective and the components is think about the characteristic to consider. How close is the measurement for a wearable sensor to the true value? Sometimes the true value is not even known. Think about fatigue sensor. We don't even have a metric to measure it that is established and accepted by everybody. Or is it possible to say that the sensor is going to provide the same output when it's exposed to the same condition, so in terms of precision? Or is the sensor able to detect a change in condition? And how small is the change in condition for the sensor to be detected? Or what is the variability inter-unit? If we have three identical sensors, will they read the same to the same condition, or there's going to be a variability? These are conditions that we need to consider from a scientific perspective. From a technical perspective, is it possible that a wearable is going to be connected with other wearables that we're going to have on our body? Or is it possible that it's going to share the processor, the power, the graphic user interface, so that we're going to have 4 or 5 outputs and monitors on our body? Are we going to have issues in terms of radio frequency? for example, because one monitor might interfere with another monitor, and that's common at the moment. And finally, is the cost a factor to characterize a certain wearable sensor? If we need to spread these monitors for every single worker or in a certain population, cost might be a factor. And so these are technical or technological characteristics. Finally, for wearables, we also need to consider if a wearable sensor is robust enough, because it needs to be sustained the use of a person for who knows how long. Or there is a good user interface, or it's easy to use, easy to learn how to use it. And finally, what is the burden? It depends obviously on how long it's going to need to be on the body, but the burden for a worker or for a human being is an important characteristic to consider. And these, I think, are very specific to wearables. Finally, I'm going to show some information about possible technology already out there, from smart glasses that can be used for fatigue studies to, for example, wristband for ultraviolet exposure detection. And the second one, the wristband, they have no data transferring, but just a graphic user interface, changing color to alert the worker or the person that is reaching a certain level of exposure to UV. From very minimal technology to very high technology of bendable sensor array for a wristband, where the transferring the power is actually coming from the worker itself, or the person itself. Or smart gloves to detect chemical threats just with integrated sensor inside the gloves, for example, for hazard identification. And smart textile is honestly a big topic at the moment, with the integration of sensor inside the fibers for the minimization of the burden to the worker that is already wearing a vest or a certain piece of clothing. A wearable sensor can be also personal protection equipment, like smart hats, where we have sensor for temperature, or sensor for gas and vapor, or sensor for noise that can detect and alert the use of personal protection equipment. At the same time, the use of augmented reality for safety glasses is definitely a reality at the moment, where the augmented reality superimposed can provide guidelines to a worker for a certain activity, and the guidelines is come remotely from a long distance. For safety boots, there is actually at the moment, there's some small study on that, where the boots are studying ergonomic effect or musculoskeletal disorders conditions, or issues like safety for slip, trip, and fall, for example. And finally, probably the most interesting wearables, or the most exciting for the future, are going to be implantable. In the health monitoring or the early detection of conditions is honestly the most interesting part, where we can have bands that are detecting early presence of lung cancer, for example, at our wrist, where there is a sensor that is collecting information inside under the skin, or sensors that are biodegradable, so they are actually destroying by themselves at a few months to check for recovery for injuries, where the sensor is using information about how a muscle is healing. Or contact lenses that become smart contact lenses for glucose monitoring in augmented reality, or implantable sensor for heart conditions in real time. And all this is possible through 3D printing of two-dimensional sensor and circuit, and bendable in the use of advanced material. One final possibility in terms of implantable is just honestly the idea of ingestible sensor, and this is done generally for health conditions where something is ingested, collect information, send them out, and then it's obviously gone already. So I have some final remarks. The idea is definitely that monitoring data, and so with the use of even wearable sensor, is going to be an integral part of the fourth industrial revolution, because data probably is the fourth industrial revolution, if you want to think about it that way. Personal monitoring is already a reality, but we're going to evolve gradually even more wearable monitoring possibilities. That means smaller, more of them, more spread, and less invasive and less burdening. But at the same time, we're going to have benefits and responsibility. That's going to be possible thanks to 3D printing, the idea of new materials, the miniaturization, data analysis, and data sharing as well. I hope that at least with few slides that I had, I already started to give you the impression that definitely all this is very exciting, but at the same time, we're going to need to have an appropriate selection of the sensing technology in a knowledgeable use of the technology. And this is possible in summary with the adoption of the right sensor, use it right mindset. And my last slide is something that I found from a paper in 2018 that is wearable technology from A to Z, which really it just was an exercise to show how complex is the field of wearable technologies and wearable sensor, because there are so many aspects that need to be considered that we can go from A to Z. And with this, I'm going to hand it over to Jen for the next part of this discussion about wearable technology and wearable sensors.
Thank you very much, Emanuele. That was a very interesting overview, and I'm going to build on that with my presentation next to talk about taking all of these really impressive and amazing technologies that we are developing very rapidly that have incredible potential to really improve our understanding of health and early detection of disease and so many benefits that can be seen from many different perspectives, but also then thinking about how we make sure to manage that appropriately, because we have some real questions to consider about privacy and data collection and management of that data and appropriate protection of the privacy of workers, for example. So I'm going to talk a little bit about how to take all these data that could be collected and really have an impact on our workers, both in the workplace and at home and for their whole lives, and how we might design or develop programs that would be effective and be positive for the workers and to have them want to be active participants and engaged in those programs. So some of this is just a little bit of background, but I wanted to revisit some of the key things that we're talking about when we look at exposures and specifically collecting data and information about exposures. And I think Paul touched on this very nicely at the beginning, but we really have, when we look at this concept of the exposome, and Paul had also mentioned the work of Dr. Wild, but we have several areas where we can be collecting data now, and sensors that increasingly will help us really quantitatively characterize some of these areas of potential exposures from the whole environment, and not just the workplace, but all of our lives as we're living. And that's not just the specific external factors or stressors, such as radiation or infectious disease agents or chemicals, but also the general external factors that might include education or psychosocial factors. Dr. Cauda or Emanuele mentioned fatigue as one that's a very interesting one, and how these might interplay and how our use of sensors can help us to really improve our understanding of these complex interactions and ultimately really help to improve the health of our population. And so just a little bit more on the external exposome. I think this is where the sensor technology and data collection is focused. Of course, we do have the internal exposome as well, where we look at metabolism and other sort of genetic susceptibility factors. But when we're looking about data collection, I think today that's really our main focus is what's the external reaction with, or interaction, I should say, with the environment, and how can we collect better information about that to improve the health of the population. So this slide is actually one that I've liberally borrowed from Paul. So he presented this at a previous presentation, but I thought it was such a nice interaction of these different aspects of the exposome and total worker health. And you see right in the center, there's this really key overarching factor that we have to consider and discuss and address up front, which is ethics and values. And so we really have a very interesting and complex sort of challenge or push and pull when we talk about collecting these data, not just in the workplace, but outside the workplace, between a responsibility to protect the privacy of workers and protect the privacy of individuals and their data, but also, I think, on the other side, of responsibility to help to use these technologies to improve health and to improve our understanding of disease agents and other factors that might ultimately negatively affect our health. So just again, a few more of these issues that we have that can really be affected by the total worker health programs, and why we really should be thinking more and more about making our programs more holistic. There's so many factors that we can improve and affect with respect to total worker health programs, and thinking in a holistic way, from policy issues and community health, community support and issues, to the way we design our environments that we live in, the way we organize the work that we do, and then just acknowledging that the workplace itself is changing so dramatically. Again, as Paul had mentioned earlier, the line between the workplace and the home is blurred, very much so now, where even if we're really focused on just protecting the worker in their workplace, that workplace is often the home for them, and the workplace is often the environment that an individual lives in, and not just a specific place that they may go to for 8 hours a day. So, some of the things that are value added for total worker health, and some of our, I think, ethical responsibility to act to help to understand these things include improved health outcomes, early disease detection and prevention of adverse health outcomes that can be addressed early through wearable sensors. And I think particularly it's very interesting to think about the implantable sensors and being able to get early disease identification from folks, and how powerful that could be ultimately for our improvement of health long term. Some other really, I think, interesting and striking data that we can consider or use to help advance or promote the notion of why we need total worker health is looking at some of the just general health trends with respect to the general population of the United States, not just the workforce, but you can see that from the 80s and 90s to today, the percentage of the population that has reported being in excellent health has declined pretty significantly by more than 50%. Those individuals who need an assist just to walk and to be able to get around has increased. Those who are limited in the work that they can do in their functionality has increased, as well as those who have functional limitations. And we've known for some time that rates of obesity have been increasing in our population. That's not a surprise, I think, to many of us. But we also see other concerning trends, such as the reduction or decrease in regular exercise by many in the population. We have seen some improvements in smoking, and that's very good, although with some of the new e-cigarette questions, that may be something that will be also revisited in the future. And so, why total worker exposure? What are the reasons that we would want to really focus on trying to establish these programs to collect these data through the available technologies that we have? We have many outcomes that can be improved through collecting those data to help workers improve their health, not just in the workplace, but also in their whole lives. And those can include productivity outcomes, both on and off the job, just general well-being, of course, again, as Paul had talked about, importance of improvements in physical health, healthy behaviors that can be influenced and encouraged, and just general healthcare outcomes for individuals, so fewer days of disability and other lost days to disability from impact and influences on exposures or the exposome and those external factors. And then, of course, as those of us who are industrial hygienists know, we do really have this core competency and very relevant skills to help us address some of these questions and collect these data. For many, of course, years we've been collecting data in the more traditional sense, again, as Paul had mentioned earlier, where we might collect an air sample in the workplace and then we send off our sample and receive the results back. But I think those skills that have been learned for exposure assessment and measuring exposures are very directly applicable and relevant to total worker health and total worker exposure, and can be, I think, directly adapted to really beginning to look at these programs. Though I think we want to acknowledge that there's also a real important other side to this, which is the ethics of collecting these large amounts of new data with these new technologies that we have. And I think many kind of conflicting questions that we have to address. For example, is it unethical to collect sampling data for workers outside the workplace? But on the flip side of that, do we have an ethical responsibility to collect this information and share it with the workers if we have the technology and ability to do that? And then also the use of those data. So if we do collect sampling data, and that includes data that are relevant to workplace exposures, but also exposures outside the workplace, how should these data be used, or how can they ethically be used? And how should they never be used? What limitations should be placed on those data that have been collected? And I think also, what are the roles or actions of the health professional or the industrial hygienist and employers that can best serve workers and their health long term? So we do have some good research and information that are available to help us design some of these programs for maybe larger scale sensor technology use and data collection, so that we really follow what's already been done, the great work that's already been, kind of the trailblazing that's already been done with respect to ethics and protecting the privacy and ethical considerations of workers both inside and outside the workplace. We have, for example, very good ethical statements and contracts and guidelines from organizations such as the American Industrial Hygiene Association and the American Board of Industrial Hygiene, which has now changed its name to reflect a broader set of professionals who are included within that certification body. But some of the things that are noted there are, for example, the use of sensitive information and personal data, and what we do with that data. We must always endeavor to protect information and not release it unless we have specific authorization to do that. It's also an ethical responsibility to remove personal identifiers from information before it's disseminated or shared. And I think it's interesting, for example, that we need to even be thinking about samplers that could collect individual personal information that's perhaps difficult to separate from the data itself. One example of that could be biological monitoring samples, which, while collected for a particular purpose to, for example, look for a particular biomarker, may also have other genetic information that is relevant to other questions with respect to the worker's health, for example, blood samples or urine samples. I think it's also important to remember that it's not just enough that the greater public health would be improved through the use of sensor technologies or data collection. We also need to really respect these other ethical considerations. Also, conflicts of interest need to be carefully navigated, and I think those can arise pretty quickly when we start to collect data on total worker exposures if we haven't thought through the way to do that, or the best way to do that to protect the critical things that we need to protect. So there's some very, as I mentioned, some very good research that's been done already in this area with respect to ethics and ethical considerations related to wearables specifically, or nanosensors, which is a subset of that area. This is a particularly, I think, helpful article that was recently published in the American Medical Association Journal of Ethics. And they point out in this journal that we really have this incredible potential, and then I think associated with that a responsibility to be able to improve worker health, productivity, and wellness by monitoring certain types of adverse exposures and early disease indicators. And it really creates this great opportunity to have a global impact on improvement of health. However, in this article, the author also noted that there's historically often been concerns about these types of programs that were well-intended, for example, or intended to improve wellness of workers, but which were perceived by the workers as being perhaps intrusive or heavy-handed, or perhaps required as a condition of employment, which I think are some of the real considerations and concerns that we want to address before we start to develop programs that are designed to collect information across both the workplace and outside the workplace. There are some nice recommendations that have been published with respect to wearable sensors and how we might design programs to really make them as ethical and ethically appropriate and acceptable as possible. And here's some nice recommendations that also appeared in the AMA Journal of Ethics, that a great way to help improve the ethics of these programs is to start with collecting voluntary information versus mandatory participation. So seeking out individuals who are interested in being involved in these programs, who'd like to be active partners in the research process, who will have something to gain as well from collecting that information and learning about their own health. And looking at that as kind of a way to set up a win-win situation that everybody can benefit from. And I think there's some critical, of course, things that need to be set up in advance, such as the use of the data ultimately and how it will be used once it's collected, and how transparent that process is. So I think participants need to know exactly how their data will be used and how it won't be used prior to agreeing to participate in data collection efforts that are broader than just the workplace. I think it's really important also to look at validated technologies. And this speaks to something that Emanuele also talked about, which is the right sensor, used right. And I think I didn't say that exactly right. I apologize. But the point is that the validated technologies need to ensure that the data collected are in fact accurate and appropriate. So we don't want to create concerns for health unnecessarily if the sensor technologies we've selected perhaps have a very large uncertainty or don't necessarily provide sufficient accuracy to be helpful with respect to understanding disease questions or generate concern from the users based on the data or output that's received. And I think some folks have advocated that data collection should be limited to the workplace still. I think that's something that's open for discussion, and some of the other things that I've looked at here in terms of research I think allow consideration for how we might think about collecting data that would cross the bridge between both the workplace and outside the workplace, acknowledging that often it's difficult to define what the workplace even is today. And then I think finally the management of the data once it's collected is critically important, and being able to ensure the security and privacy of that data is of utmost importance prior to starting a program of wearable sensor data collection. There's some good resources that can be used to design these programs ahead of time before starting to try to collect data. There's some very nice principles of data privacy and transporter flows of personal data, for example, from the OECD. And these are available online for free, and they have a nice outline of what those principles of data collection are. In other words, getting permission to access private data, protecting any personal information that's been collected. And that can be a real challenge in today's world. We know we have a lot of issues with computer security and ability of hackers to access and examples of hackers accessing tremendous amounts of very sensitive private information. And when we talk about wearable sensors collecting a tremendous amount of individual information, second by second about a person or about a population, that's a tremendous amount of data that needs to be protected. And then I think, as I previously mentioned as well, others have also agreed that the use of the data should be transparent. There should be disclosures up front about exactly what will be done with an individual's data once it's collected, what it will be used for, and specifically what it won't be used for as well. I think one of the more interesting ideas that I saw in the course of my research and looking at ethical ways to design programs to collect sensor data in a broader sense is considering the concept of design contractualism. And this is a way to basically make agreements with the participants around a proactive initial ethical contract that could upfront address questions of privacy, transparency, data use, and data security, so that the participants feel comfortable with the way the program's been designed, and that those ethical considerations have been addressed, so that they feel more willing and comfortable with the data being collected and knowing exactly what's going to happen with that data once it's been collected. This is just an example of a social contract similar to that might be used as sort of a construct for this. And the Debian social contract relates to development of free software. And I think this started with some of the free operating systems, for example, on computers that have been developed. But I like some of the ways that this organization, especially the Debian social contract, has been constructed where even though they're offering a free product and giving it away, they want to be transparent about the construct and what that means, why they're doing it, what that means, what is available, what isn't available, what's part of that agreement to give away this free software. So I think it's an example I would encourage that we consider in the field of public health to maybe help us design our social and ethical contracts around these large data collection efforts if we want to undertake them. So, for example, one of the things that this social contract does is just lays out what the agreement will look like. It's going to be 100% free all the time. We're going to give back to the software community. We're not going to hide problems that come up. What our priorities will be, what the ethical priorities will be to this process, and what we will and won't provide, for free. And so I think when we look at these programs then, or trying to design a program where we can really effectively collect data using these amazing and ever improving technical wearable sensor devices, those are the things that we want to make sure we do. So we want to ensure, of course, data accuracy, privacy, and security. Of course, this is especially important when collecting broader data outside the workplace as well as inside regarding individuals. Make sure that we protect what could be potentially enormous amounts of data that might be collected. Make sure that data is used only in the way that it's initially described to be used, or what do with the data what anybody said they would do with it, so that it's not misused or used in ways that were not initially disclosed. And then also the use of standardization. Emanuele also talked about, for example, RFID technologies and improving standardization to help with both privacy and transparency of the data that are collected. And I think another really critical point is, as a couple of the other papers I cited here have alluded to, that perhaps a good way to start with these programs is to recruit volunteers versus forcing participation in these programs. Empower workers to be voluntarily interested in participating, help them to become research partners and advocates in this process. I think an interesting way to do that is there are some interesting sort of notions that have been circulated in some of the literature and that individuals in our population are now very much a part of, which is, for example, the notion of the quantified self. Individuals who want more information about their health, who want more information about their quantifiable health factors or things that can be collected. And we see those through Fitbits and through wearables that are used for exercise routines and other types of scenarios. People, in many instances, really want to have that data and are often willing partners with the right kind of contract or ethical contract regarding how that data will be collected. And so, really, it's kind of a win-win situation where individuals would like to have that data, and then if they agree to share it, then it can be used to help improve the greater good for all of public health. And I think another, case study that we could look at for that, there are several programs going on in Europe right now which are doing this actively. They're recruiting participants from the general population to help, for example, with air quality monitoring. A program called CitySense in European cities is a project that's been developed, and it's a sensor-based project that allows individual private citizens to collect data to help understand air pollution in European cities. And then there's a couple of other examples as well, using smartphone apps to help collect local air quality data. Or a great example I thought was a program that it recruits volunteers from the public to use low-cost optical attachments to smartphones to help measure the aerosol optical thickness, which is also an important indicator of air pollution and air quality. So I think there are some good examples that have already been developed and started in many instances. So in summary, I think it's important to think about the ethical questions and considerations that do exist with these data collection efforts. I think, we all, have a lot of excitement around these opportunities to collect a tremendous amount of additional data and to really have a significant impact on improving the health of individuals through these data that can be collected through wearables and sensor technologies. But I think we also want to make sure that before we start to do that, have a good process for collecting those data. And I think some of the recommendations that I would see based on the literature that's been published to date would be to create social and ethical contracts for participation, to consider starting with voluntary participation versus mandatory programs, to really carefully evaluate and consider data accuracy, privacy, and security prior to starting a program, and then to recruit volunteers to help with these programs, to make them active and engaged participants in the research process, and then to have them have a real benefit from their own understanding of their own health through that process. And with that, I'll wrap it up. Thank you very much.
Well, thank you, Jennifer, and thank you, Emanuele. I think people can see that we are on the frontier of exciting and daunting times as far as worker safety and health. The technology is going to enable us to do a lot of interesting and important things that can be helpful, but there are many dangers, I think, awaiting, and the whole interface between work and home and roles of employers and gathering personal information is a slippery slope, and we're going to have to pay good attention to that and not just barge forward. So let's go to questions. We have two questions right off to Emanuele, one on the speciated analysis of VOCs and another on selectivity and dynamic range of sensors. Emanuele, you want to speak to some of those issues?
Absolutely. I'm going to try to do it as best as I can. So regarding the VOC, that's an interesting question, because obviously the use of PID and other portable personal monitors is well established, but the specification of different VOC is still a challenge. At the moment, there are some personal bulky STIRs, for example, that can be considered personal monitors. I would definitely not consider them wearable sensor, obviously. But I would report back the idea of the objective. If the objective is to have a real-time monitoring, we might be way far in the future for specification of VOC. If it's a perspective of having a badge to collect information that can then get information in terms of direct reading at the end of the day for specification, micro GC with FID, for example, they can be quite portable and so field deployable. So it really depends on the information that is needed from that perspective. The second question is about dynamic range and selectivity. Selectivity obviously can be another important characteristic to consider. I'm more interested about the dynamic range because sometimes we are tuned to the idea how well a monitor or even a sensor is going to behave to a certain range. And especially when we're talking about low-cost sensor, this is a paradigm that probably we need to change because we might not be even in a position to check how accurate can be a sensor to a certain range. So sometimes go back to the objective. Do we want to be accurate at each level, or do we want to just know if a certain level is reached or is above that level, the information that we needed? So the identification of the objective is critical, again, also in this case.
Good. I'm going to throw in just a question for me that follows on from that. It seems that most of the things that you were talking about were sensors that sensed one particular exposure or hazard. What is the status of sensors that will be able to sense multiple hazards at the same time?
That's a very interesting question. So when I was talking about modular wearable technologies, for example, or the idea of optimizing what we have in terms of space, for example, as a body, that's one thing that needs to be considered. I don't think there's a lot of done on that respect. There's a little bit in aerosol monitoring where it's possible to monitor aerosol at the personal level on multiple size ranges, for example. But if we're talking about, for example, wearable monitors that have sensor for gas and noise and particulates as well, I think there's very little, but there's a lot of room for improvement in that area.
Okay, maybe we'll get back to that in a little while. Yeah. Jen, the next question, next two questions really look like they relate to you. What privacy issues do you see coming forward in sensor use in the non-work world?
Yeah, I think that those questions are going to be significant. I think that we've had some challenges, and I think the population, the public, is particularly alert to data privacy issues. With some of the questions we've had with large websites, which do collect a lot of private information and actively seek out that private information and sometimes sell it to other people. So I think that we are going to be in a situation where we really need to address these issues carefully and talk about them in a very transparent, open way prior to developing and formalizing a lot of these programs and rolling them out, because I think the public is very sensitized to issues of privacy with data, and that's why I think some of these ideas about developing these ethical or social contracts up front and soliciting volunteers who understand up front how their data will and won't be used and what their benefit would be to participating might be a way to really think about improving our opportunities to collect data outside the workplace in addition to inside the workplace.
I'm going to add a question here too. What do you, privacy clearly you identified and then you elaborated on is a critical issue, and will be even more so when we talk about the outside the workplace information. And one of the things I'm wondering though about within the workplace, and maybe Jen, you'll pick up on this, and Emanuele as well. To what extent does a worker then have a right to take some action based on a reading on a wearable sensor? And what is the status of processes and procedures for how individual workers deal with that information and how it's shared with employers, how immediate actions are taken, how long-term actions are taken? You want to start on that, Jen, and then maybe Emanuele might have something to add?
Yeah, certainly. That's a great question. And I think we've seen that actually for a lot of years already with biological monitoring. I think is sort of the really initial, the precursor to a lot of these in the concept, a lot of these ideas of collecting more robust data that has greater potential to be, to give us information beyond just what we were even looking for initially. And so I think there are some real ethical considerations around that. But I also think that there's been a lot of concern, and I think we find that, for example, maybe because those questions haven't been adequately addressed to date, or just because of the concerns of employers not to overstep those bounds, that we do see, I think, for example, a lot, a lower percentage of use of biological monitoring, for example, than we might otherwise see if those issues maybe hadn't been already better addressed or discussed within the workplace, and having a better way to have everybody feel comfortable with that process and participation in that process. So I think the ethics of this question of, using the data collected from a wearable sensor to address a health issue that maybe wasn't the reason that the data were originally collected is a really significant issue. And, I think once we have the data, in a lot of ways we have an obligation to figure out a way to address that and to help the worker to address that.
Emanuele, maybe you could go ahead.
Yeah, that obviously was a very interesting question. I would like to give a positive spin to my answer, which is we've been studying, and there's been studies done even in NIOSH about how the engagement and empowerment of the workers with personal monitors has been extremely beneficial, extremely significant, so that the worker that is taking charge and taking responsibility of certain reading for our real-time monitoring in terms of action and implementing a change, a positive change, and even to another level, from a perspective of risk communication, the use of real-time data or really timely data from sensor, that the data that can be pretty much a tool to facilitate the communication between the worker and the health and safety department, or the health and safety department with a corporate health and safety. It's very, very effective. So I totally see the concern as well as Jen, but there are also a lot of really potential and benefit about the interaction between data and information and timely information with the worker and everybody involved.
Oh, I think that's a great point. And I didn't mean to sound too negative. I think it's more just treading carefully, or maybe thinking about these questions ahead of time to try to create a safe construct around which those can be those kinds of issues can be addressed. But I think that those are great points.
Okay, here's another question. Either of you can speak to this. Have there been any studies looking into worker acceptance of using wearable sensors in the workplace?
Yes, there have been a lot of studies. I can start maybe a few seconds, and Jen, you might.
Oh no, please go ahead. Go ahead.
There have been a lot of studies, especially in the use of wearables. I think in manufacturing, so in the literature, there's really a lot in the last few years. The main message I think that is quite common is that when wearables are used for health and safety, the level of acceptance or potential acceptance is quite high, because workers understand that those are used for their own good. When there's other components, whether it's to verify the productivity or from a control perspective, the level of acceptance gradually drops down.
Anything to add?
No, I haven't looked at the specific literature to the extent that Emanuele has, so no, thank you. And Emanuele, if you have anything else you wanted to add, that'd be great too.
No, not at all. I mean, the only thing that I could add definitely is the idea that that's still a big component about from an ethical framework, even from our perspective as NIOSH, as a center, that the acceptance of the workers, it needs to be key, so to involve them in the decision-making of using them.
What about on the other side of this? Has there been studies of the acceptance of employers to support workers wearing these kinds of things?
From my more informal understanding and discussing this with some groups who have specifically been looking at this issue, I think there is a lot of concern about how to collect the data in a way that's appropriate and that doesn't overstep the bounds of the privacy of the employees, but then it's used for good and used appropriately. So I think the employers I've talked to have indicated that it's a big responsibility that sort of concerns them in terms of making sure that if they're going to do it, they're going to do it in a way that's socially acceptable and appropriate.
It seems that what you said earlier, Jen, is the key, that before you embarking on a personal sensor, direct reading sensor program, the processes for how the information is going to be used, the procedures, the actions that can be taken, and so forth, all really need to be laid out so it's clear cut rather than just winging it.
Yeah, I think so, and I think with that process and engaging the workers in that process, you could come up with a very positive and very influential and encouraging system and program to do that everybody is fully engaged in.
Okay, here's another question for either of you. Do you sense that we are reaching a tipping point where enough occupational health and safety professionals are ready to leverage emerged technologies to provide value beyond only compliance?
Maybe I can start briefly.
Yeah, go ahead. Go ahead.
Okay. I think there's definitely an appetite for new technologies and emerging technologies in the occupational health and safety field, and so for the professionals. The concern about compliance or beyond compliance at work or outside, where is the draw line about what is acceptable to do it or not? It is still there. I think as my impression of the profession and the professionals, there's definitely an appetite for new technology. It's been always for things that is new and is providing more information and better information. The compliance itself is just one component because there's much more that is done outside compliance, beyond compliance, just from a perspective of process monitoring, process optimization only.
Yeah, I totally agree, and I do think there is very much of a trend to move beyond compliance, and I think we've seen it. I think the public more and more is demanding or really asking for more information regarding chemical exposures and regarding better transparency around, whether it's in the workplace or outside the workplace through the use of consumer products, more information. And I think also companies and employees of those companies and managers of those companies want to provide that. They also understand the social value and responsibility of being engaged in that process. So I do very much see a direction, move in that direction of moving beyond compliance and companies wanting to be more socially engaged and helping to improve these health outcomes and understanding of the public of their health.
Okay, here's one, Jen, that you might take a shot at. How do you prevent individuals to use their exposure data to complain to legislative bodies to attempt to obtain compensation? I guess you get the gist of it. How do you prevent yeah, go ahead.
I think certainly, anytime an employer is, has a work environment which has the potential for hazards to exist, they need to be controlling those hazards and working within the rules and regulations that have been established. So I would imagine that could come up whether or not new technologies or sensor technologies are being used. I think that's just a question that any employer needs to consider and to address carefully. I think that I think any employer would expect that might be something that could occur, or those questions might arise.
And I think it really plays out in workers looking at their wearable, and they see that they're generally below a limit, an occupational exposure limit, with maybe an excursion or two, and then somehow they get sick, and then they want to say, well, there's still, I did have exposure, and the limit was not in the right place, or they have information that they were above exposure, and then they really can say, hey, I was above the limit, and I deserve compensation for this health condition. So I think there are a lot of those kinds of issues that will arise that can be dealt with, and we have models and histories with dealing with them, but that needs to be thought out before those things get put into place.
Oh, absolutely, yes.
I agree as well. I mean, is the idea exactly of having a very good understanding of what are the benefits, and it's also the limitation of each single technology is crucial to avoid this type of situations.
Here's one for you, Emanuele. How would one integrate multiple exposure inputs that can be used to express risk? We can't do that now. We only look at one chemical risk at a time, even in complex mixtures. We started to talk about this a little earlier, the whole issue of multiple exposures and multiple findings on a sensor or groups of sensors, and how you make sense of it.
Yeah, and I know that I kind of winged the answer because it's a difficult question, honestly. And I think without giving really a specific answer on a specific case of multiple exposure, but in my opinion, you need to go back to the board to understand exactly what exactly do we need. So what type of data point we need, what is the frequency of the data. Because to have a magic wearable sensor that can provide us as many exposure data that we want in a very fine frequency, it might be very difficult. We might need to accept a compromise in terms of either to have multiple exposure but with a low frequency, or very few exposure with high frequency. So I don't know if I have a right answer for this. In general, Paul, if you have better take and perspective, please add something.
I think it's appropriate not to have answers to a lot of these questions. I think that is indicative of where the field's at. The technology has jumped out ahead of the ability to use it and to understand it and to use it safely. And so that's our challenge. And so we're not going to know the answers to a lot of these questions.
Yeah, I think that's exactly right. I mean, I think one of the biggest challenges we are facing is these potential interactions between multiple chemicals and multiple exposures, and how that might ultimately be influencing our health. Maybe at levels lower than current exposure limits, for example. I think we just don't have the answers yet on those questions.
If I can add just for 5 seconds, the interesting thing could be the more information we can get from a predictive modeling perspective could be quite interesting, because we might see the effect of, as I said, multiple exposure on a single effect that we could not do before.
A question that relates to a lot of this is, would the type of data collection require IRB approval? I think it would depend on a lot of things. If not in a study, if you're doing a study, probably yes. If you're doing routine monitoring, that may be a different kind of human subject considerations. Jen, any thoughts on that?
That's a great question. It's something actually I looked into and thought a little bit about as I was preparing my presentation for today, and thought about maybe even including some discussion of that, because actually the process of the Institutional Review Board for developing research studies, and this very transparent process of informing the participants up front of what you're going to do, what you're not going to do, how the data will be used, what assurances you can make about that process, I think is actually very similar in a lot of ways to this idea of a social or ethical contract around data collection. So I think there's a lot of comparisons there. Now, you might not want to use the actual IRB process for something like this. There's some very prescriptive protocol requirements, for example, with IRBs, but I think the concept is very much valid and applicable here.
Right, and of course, to distinguish between doing research and doing routine workplace monitoring needs to come in there. Well, folks, we're out of time. I'm going to turn it back to Emily. Thank you, both speakers, for your great presentations. Thank you, audience, for some insightful questions, and we'll turn it back to Emily.
Thank you for joining today's webinar. If you had any remaining questions that weren't answered, please direct them to twh@cdc.gov, and that concludes today's webinar.